Hi, my name is Dr. Moses Githinji. I'm the resident medical officer at Ngara Comprehensive Health Services, and today I have the honor of partnering with Ponea Health to discuss about acute abdomen. Karibuni. What is an acute abdomen? Basically, acute abdomen is the sudden onset of severe abdominal pain in a short time or short duration of time, usually within less than an hour up to 12 hours. What causes acute abdomen? Well, I think the best way to answer this is to actually say that acute abdomen has a myriad of causes. The best way to think about it is I would think about it from a point of view of causes. So you have infective causes, you have anatomical causes, you have causes due to injury. Just to mention a few, acute abdomen can be brought about by conditions like gastritis or peptic ulcer disease, can be brought about by appendicitis, can be brought about by intestinal obstruction. Acute abdomen can also be brought about by things like ruptured ectopic pregnancy, abdominal injury, say in an accident, blunt force trauma, or any injury to any organ within the abdomen. So in a nutshell, it's just severe onset of severe abdominal pain. What is peptic ulcer disease? Again, as the name suggests, it's an ulcer. It's an ulcerating disease. Peptic to mean it's anywhere between the lower esophagus, that's the food pipe, the stomach, and the first part of the small intestine, which is called the duodenum. So basically what happens is the inner lining of either the lower esophagus, the stomach, or the duodenum is eroded due to either hyperacidity or drugs or any other causes that may precipitate the condition. PUD, this is peptic ulcer disease, has various risk factors. Some of them are modifiable, which means they are lifestyle risk factors. Others are genetic, others are actually anatomical. So some of them you could have are obesity, alcohol intake, smoking, drugs or medication, especially people who self-medicate on painkillers. These are called NSAIDs, the diclofenacs, aceclofenacs, and aspirins of this world. Others could be anatomical, people with things like what is called a hiatal hernia, where your stomach basically goes into your chest cavity. And yeah, I think just to mention a few, those are some of the risk factors. H. pylori is actually a bacteria. It's called Helicobacter pylori. It has been associated with gastritis and ultimately also with cancer of the stomach. However, it's one of those commonly misinterpreted and mistreated conditions. My take would be that yes, H. pylori infection is a risk factor for peptic ulcer disease. However, if you screen for Helicobacter or H. pylori infection, almost about 50 to 60% of the world's population is infected by it. So unless you're symptomatic, which is where you visit your medical practitioner, I think it's asymptomatic in most patients. So thank you for joining us in this discussion. You can book our services at ponea.com, and we look forward to joining you in more discussions. Thank you.